one of the things that we're looking at is what happens after the the emergency response is finished. If you listen to the president's speech on the COVID conference that my colleagues Godemas and so on were involved in, it is very clear that what the emphasis now is for us to shift to strategic and also shift into structural and long-term engagement. Yes, so the points I wanted to share just briefly about the work that we're doing in terms of analyzing what Kenya government is doing and supporting that. We have looked at what has been supplied generally, and we are focusing mainly on informal settlements across the country. So what has been supplied by government, development partners, private sector, civil society, and so on. The second thing, what are the needs in these particular areas? And we've done surveys around this. Number three, what are the sort of policy focuses that the government is looking at? And then starting to look at the gaps. And I'll just take one or so minutes to just highlight. It's very, very clear that, of course, when the emergency happened, it was mainly considered a health issue. And aside then, of course, the starting point of the supplies was actually just related to health, PPEs, and making our hospital system stronger and so on. And then, of course, this moved quite quickly into hygiene issues and so on. And then, as measures were being put in place, other measures, then it was realized that other needs for survival, like food, became very important. So that gives a very sketchy idea of what supply has been so far in this country. In terms of demand, we've done a survey in terms of demand and what are people asking for in informal settlements around the country. And a lot of what comes, the people actually want the economic environment improved. They want their incomes restored, the businesses, they want their source of livelihood done, and so on. Linked with that, which comes a little bit lower, is food. Then, surprisingly, I mean, issues to do with health, like testing and so on, come a little bit lower. Then we have an array of social issues that are coming in quite strongly: mental health, issues around violence in the family, issues around pregnancies in schools, and so on. Yes, so already you're starting to see that whatever is being supplied, which is focusing on health and food, is already mismatching demand, which is basically focusing more on economic and livelihood issues and a whole array of social issues. The other thing we're looking at is policies. What policies is government invoking? Of course, when these came in, we saw the president invoke the Public Order Act and policies relating to that. But fortunately, the country shifted quite fast to start, using a lot more of the health policies and the health-related acts and so on. Yeah, so we've seen quite a bit of policies relating to health, relating to sanitation, relating to public safety and security, relating to food security, relating to economic development, and actually also education being invoked in terms of a response. Having said that, of course, when you look at the supply bit of it, and then we look at what is needed, what people on the ground in informal settlements in Kenya say they need, and the sort of policies that are being invoked or that we need to put in place, already we see a mismatch. And part of what we're trying to do is to start making recommendations to government that would then inform what the president was talking about on Monday, would inform strategic, long-term, means of actually building or rebuilding our societies, as it were. I'm finishing my remarks by just saying, what does this have to do with the way cities are built or the resilience of cities? And the answer to my own question there is everything. In fact, you likely realize that quite a number of the interventions that are being asked for, particularly if you start looking at demand, have to do with the way our cities are organized, the way, both spatially, uh, economically and even socially. Yes, of course, not looked at this in a lot of detail as to give the result, but a map is actually starting to emerge that, yes, I mean, to be able to have more resilient cities, shocks, including, but not limited to pandemics, then of course we need to think quite carefully in terms of how we build our cities. We have to look at issues like congestion. We have to look at how we enable economic development to happen. We have to see how you know, we plan our cities so that they're more hygienic, so that they enable a whole lot of things that we're going to discuss here: healthy lifestyles, non-motorized transport, pollution that Winnie and team was actually talking about, and so on and so forth. And of course, the pandemic has enabled us to look at this in a lot more details. I just wanted to make those initial comments, and again, just thank the team for allowing us to have a glimpse in this research and also share with you. Yes, I would now like to invite Patrick Adolwa to make his comments. And of course, we know Patrick and I actually worked quite on a number of issues, but of course, Patrick was the one behind the National Urban Development Policy that has a lot of issues to do with resilience. Patrick has ran our top 2 cities before. Patrick and I also worked when he was Deputy Director of Urban Development. Patrick, of course, is also one of the key brains in Konza Techno City. And Patrick, I would like us to make your comments there to at least tell us, in terms of these issues that the research is raising on resilience, what can we learn and what can we do better in terms of planning our future cities? Patrick, you have your next 5 minutes. Thank you.
Let me begin with the African city, and I think that's where the whole story begins. We may be unable to do this subject justice unless we understand the underdeveloped nature of the African city. And the African city primarily remains the colonial city. Unfortunately, many years down the line, we have not been able to refocus the African city to be able to produce that which it should produce for its independent states. And therefore, cities in the South, and Africa in particular, are vulnerable due to, specifically, if you ask me, the underdevelopment. And when I say underdevelopment, I intend here to summarize all the systems and structures that you see in African cities that could otherwise be much, much more developed. And in the context of that underdevelopment, we find all the vulnerabilities that you can think about. And it is this vulnerability that we must speak to, which vulnerability is far beyond climate change and far beyond COVID. So if we are thinking and beginning a discourse on underdeveloped urban systems in Africa, I think we are in the most vulnerable space anyone can ever be. And that is where the problem is. And I like Kezia's discussion on the context of cities and COVID-19 and the stresses and shocks. It surprises me that people would have expected African cities to fare any better in the event that they encountered any one of these shocks or stresses. But COVID-19 has exposed us to exactly what these vulnerabilities mean. They mean that the extremely fragile systems, informal economies, informal settlements, underdeveloped systems of governance predispose us to serious stresses, shocks, and even potential huge collapses of these cities. And so when we talk about huge vulnerability because of fragile economic and social systems and informal economies and so on and so forth, I think therein lies the problem. And therefore, we must begin rethinking the African cities of the future from the point of view of developing them into economic entities that can serve the countries that these cities belong to. And I'm talking here about the post-colonial city and a new economic system in which the competitiveness of these African cities must be relooked at. And as Joel was speaking, I was quite interested in a new theory of urbanization and urban development, particularly in Kenya, and if you like, across Africa as a whole, because this is the critical juncture at which these things must begin to be looked at. And we must begin to design an African system of the future that delivers not just on the economy, but is also the new way of life in an African continent. What is current policy context? The traditional approach to policy has always been to deal with this underdevelopment. An attempt has always been to deal with infrastructure, housing, water, sanitation, and a whole range of urban areas that are actually underdeveloped. But together with that, there are emerging issues. There are concerns around climate change, high population growth, informality, and so on and so forth. And more increasingly now, people are thinking about technology. And again, Joel spoke to the question of technology. Although I was intrigued when he spoke to the question of technology, because in the context of hugely underdeveloped systems, sometimes it is a huge challenge to think about smart cities, techno cities, and so on and so forth. And yet the future is about smart, resilient cities, cities that have global competitiveness, and so on and so forth. So the dilemma of the policymaker is, how do you do these things? How do you come from an underdeveloped system into a globally competitive system, into a system of tech cities, and so on and so forth? And I think that is the policy dilemma that faces us between underdeveloped systems and developing systems of the future in such a quick fashion that we are able to compete globally with those of our with the rest of the world. So this is what we are confronted with here, the dilemma of the practitioner, because in the policy space, I think there's going to be a lot of things to be done in terms of the future, and I'll just come to that in terms of a few ideas going forward. The dilemma of the practitioner is that if you're thinking about municipal systems and shocks, and you're thinking about floods, tsunamis, earthquakes, you're thinking about COVID-19, and COVID-19 is a good example how municipal systems collapse. If you wanted to know how fragile municipal systems are, if you wanted to know how unprepared municipal systems are, you just need to look at how COVID has deconstructed the traditional municipality. I mean, nothing was left in the wake of COVID-19. We couldn't even go to our workplaces. I don't know whether public transport was functional in this country. In Uganda, they virtually closed down public transport. Schools were completely closed down. You know, the only disease that allowed you to go to a hospital was COVID-19. Everybody else fled from the hospitals. So what kind of emergency is this? What kind of disaster is this on our hands? What kind of public health situation was this on our hand? And thinking about a response for this kind of unintended, even if you're talking about early warning systems, what is the early warning system for a public health pandemic of the nature of COVID-19 that happens in Wuhan? So there are serious policy dilemmas around some of these public health issues, but that just helps us to be able to start thinking, are the municipalities, are the cities as currently constituted able to deal with the changing, the changing, number of shocks, unexpected occurrences, developments, and so on and so forth. And quite seriously, I think that the cities, particularly in Africa, have a long way to go. And the policies that we have been dealing with
Patrick,
are completely inadequate.
I don't want to cut you, but it would be nice if you can wind up like in the next 1 minute.
I am going to do so.
Just for the sake of
So we are beginning to think I think we are in the space which we can call policy dilemma. And Chanu is speaking to pollution, and Winnie is speaking to pollution and urban hazards. They made a good attempt at just looking at some of the things that we could be dealing with, but the problem is much bigger, and it calls for a review of the methodology, the approaches that we use in doing urban policy for African cities, particularly now that we are looking at how to respond to unintended or unforeseen environmental issues or public health issues, and how to plan new future cities going forward. So the future African city beyond COVID-19 is a much more complex proposition. And cities must address underdevelopment, they must restructure their economies, they must redefine themselves in terms of transformation from colonial to post-colonial cities. They must think about policies at a very local level, even though we have national policies, but every city is going to have to think about detailed, specific policies to itself beyond national urban policies. And cities must think about technology, and they must think about economy.
Without further ado, I'm going to invite Penina. And Penina, of course, there's a question that we're asking: what are the practical implications of these choices that we have to make in terms of the imaginaries? And I know from your background and your interest in transport, you may actually want to address that, even as you speak to the broader element of the debate in terms of how realistically are our urban areas likely to look like post-COVID.
Okay, thank you very much, Professor. So COVID-19 has exposed inequalities in cities. We've seen the differences between the high-end urban area, the high-end residential areas, for example, and the slums, the low-income settlement. For example, in the low-income areas, we cannot even be able to practice social distancing. But then we've seen the high-end residential areas, they already have their golf courses around, or they have a few public spaces where they can at least have their children play. And so basically, in terms again of transportation, we've seen that first of all, transportation can be paralyzed, but at the same time, we cannot ignore the fact that sustainable transport has started picking up because of COVID. With now social distancing and a lot of people not being able to travel, people had to start rethinking of what to do. For example, we've seen even in the developing countries, cycling and walking becoming the main mode of transport. For example, in Paris, they have now converted over 50 kilometers of their roads to cycle tracks, which again is just about bringing in more people to ensure that they're still social distancing. Again, in terms of public transport, where again, we know our situation in the country, and of which it's highly dependent a lot by, again, the low-income people. We've seen innovation, even in this country, where now the matatus are removing some of their seats to enable for social distancing. And what I think I would like to see post-COVID is just thinking about the whole scenario. How can we maintain how can we make sustainable transport as an essential service and as a main mode of transport going forward? We've not seen that priority, because if you look at how we design our roads, we give priority to the car. Most of our investments, we have very wide carriageways, and you can tell by the number of accidents that are reported. For example, just in 2019, we had over almost 4,000 deaths just associated with road fatalities. Again, in terms of air quality, like Winnie presented, that most of the air quality is being deteriorated by the vehicular transport. And in Kenya, again, according to the World Health Organization, in Kenya we're having 18,000 deaths, premature deaths associated by respiratory diseases attributed by the poor air quality. So we need to start thinking, how do we move forward? How do we ensure that people move, vast high number of people move at the least environmental and economic and even social cost? And how can we do that? First of all, we need to start prioritizing public transport and non-motorized transport. In terms of public transport, of course, we have our matatus. But then we've seen that they are still not prioritized. Just back around 2018, when the governor of Nairobi decided to, block the matatus from coming to the CBD, we even had the biggest traffic jam ever witnessed, meaning that the public transport are not the cause of the traffic jams in Nairobi. So how do we ensure that yet they carry a majority of the people? So going forward, we need to start thinking, how do we ensure that a lot of people are able to move fast? And that's why, like in ITDP, we've been working with the Namata to design the bus rapid transit for Nairobi. And we hope that just having it implemented is going to assist in ensuring that we have smooth, a lot of people are transported to different directions within Nairobi metropolitan region, and will significantly reduce the traffic emissions coming from the vehicles. Again, we need to invest a lot and heavily in the non-motorized transport, that is walking and cycling. At least the NMS, we've seen a few intervention in the recent past. In the CBD, if you walk, you will see they are reclaiming a lot of parking spaces to just dedicate that to NMT. And what that is doing is, at least it's going to encourage more people to walk, but we need to do more. Because what happens, like for my cyclist friends, I don't cycle personally because the cycle tracks are not continuous, and you do not want to just lose your life along the road. So how do you ensure that you have a continuous cycle track from my neighborhood to my workplace? So we need to start thinking about that. And then in terms of urban development.
Lena, sorry to cut you. As you're winding up, would you say
Yes.
that there are some positives that COVID has brought, especially in some of those issues that you are raising in public transport? So as you're getting your one final minute, maybe you could address that as you wind up. Thank you.
Yes, so COVID has exposed, like I mentioned before, it has exposed the inequalities, and now we need to prioritize the majority. And again, treat transportation as an essential service that need to be operational despite the pandemics. So we need to ensure that people are moving, and they're moving at the least environmental cost. We are not polluting. And again, we need to start thinking about electrification and incorporating it in our system. And what I was going to say as I wind up, right now, most of us are still working from home. This is my 7th month working from home. So there's limited movement. But then how do we ensure that our cities provide the basic services that we require, that I'm able to shop, play within the neighborhoods that I live in? And at ITDP, we have developed standards called transit-oriented TOD standards that ensure that neighborhoods and cities are sustainable. They can be, you can be able to walk, cycle, access public transport, and the cities are compact. They're dense. The density is smart enough to prevent such, it's quality density that just prevents such pandemics from spreading. At the same time, preventing urban sprawl that again leads to all these menace of traffic congestion and the need for people to travel.
Thank you so much, Penina.
Yes.
Thank you so much. I think yeah, we got you there loud and clear, very, very sharp in terms of potential imaginaries. Yes, at this juncture, I would like to bring in Nicodemus. And again, Nicodemus and I have worked quite closely in the, particularly in the Council of Governors space. And I know that there's some type of a city, believe it or not, there's some type of a city that is being promoted by the Council of Governors compared to maybe the dominant narrative nationally, complete with the experiences and so on. I also know that from COG, even during this particular time, there's been an issue about what are municipalities and counties actually experiencing vis-a-vis what the government is doing. And this links directly with that discourse around exclusion. Nicodemus, yes, I mean, please share with us some of your insights and also COG in organizing these multiple narratives and touch a little bit on that the topic that is very close to my heart. I'm actually the convener of the Just City working group in Kenya. Nicodemus, please. The floor is yours for the next 5 minutes.
Thank you, moderator, Professor Omenya. And let me also agree with you that Adolo Patrick is a walking encyclopedia. So it's very difficult to speak after him. But also thank him for giving us the analogy of the African city from the colonial thinking to the post-colonial thinking. Let me say that for me, I want to speak to the opportunity that has been created by COVID-19, because the issue around vulnerability of cities and the policy response to these vulnerabilities has never been taken seriously the way it has been taken this time from every decision maker in the globe. And I speak, we hosted, on Monday, we hosted a top level leadership discussion around this COVID-19. And counties where I work represent the subnational level of government, where most of the city and municipal authorities belong to. Some of the opportunities from where we sit, we are thinking of is that COVID-19 has taught us that we can depend on ourselves. For example, there is high demand for the health products that are required, the masks, the PPEs, and all that. And there's also demand for locally produced materials. Now you cannot import things from other places. So what this has done, it has created a room for innovation within our cities and our subnational governments. With this, we have also experienced a lot of challenges as cities and municipalities, right from economic challenges, where we have had to waive certain revenue streams that we depend on, and yet we are required to provide critical services that are important in addressing this COVID-19 issue. We are not able to, we are telling people to social distance, yet the households that they're living in cannot accommodate that. And we're also saying that, we need to use, transport means, the way my previous presenter said, like the non-motorized transport, yet the infrastructure that we have cannot accommodate that. So with this in mind, then we have come together as cities and local governments to start a serious policy discussion on how we are supposed to wholesomely address these vulnerabilities that we are having. And we are calling it counties and cities socio-economic recovery strategies. And we are looking at them from a long-term perspective. How do we deal with these issues that have been presented here? To talk about some of these strategies, but I can broadly talk about the areas that we are thinking about. The first thing is a shift in the policy or a review of the national level policies that we are having in this country so that they can accommodate and make sure that our cities can adapt to some of these shocks that are being presented with, right from COVID-19 to climate change risks that are there and many other risks that we are talking about. Then the second thing we have been taught by this COVID is that it is possible because local governments and city authorities all over the globe keep on complaining or they have a problem of financing. But this particular disaster has taught us that it is possible to finance these local level authorities that we have in different parts of the globe. And we have different models that the country has started to ensure that they are financing these local authorities. Then from there, earlier on within the council, we had started to think about the planning that is being undertaken within the country. As you know, cities all over the world are the ones that are obligated to undertake planning, but are their plans really, responsive or are they incorporating issues of disaster vulnerability and the measures that we have to control or to manage these disasters? So this particular pandemic or this particular disaster has made us to think through re-looking at the plans that we have developed and how are these plans aligned towards ensuring that the cities and the urban areas are able to respond to some of these disasters. So we have come up with a county sort of guidance, or a city municipality guidance on how they can incorporate such kind of vulnerabilities when they are undertaking their planning. This being a forum where we are talking about research, I think it's very critical for different practitioners and different interest groups to look at really how are these particular plans that we are talking about able to respond to the disasters? Because we keep on saying that we have planned our urban areas to be resilient to these particular disasters, but nobody has provided evidence on whether the plans that we prepare are able to respond to such kind of disasters. Then the other opportunity that the country has been grappling with is, and this is something that perhaps I need to throw into the forum to discuss about. I know we have talked about the different imaginaries that we have, smart cities, techno cities. But if you look at one of the policy responses that we have had in this country is embracing the labor-based kind of intensive labor-based kind of work in urban areas. We have a national program that is,
sorry, Nicodemus, sorry to cut you there, but you still have a minute or so don't worry. I just want to make an announcement to the participants that yes, you can please get into the chat function and kindly post your comments there. We'll be reading those comments shortly, and we'll ensure that they're actually addressed or recorded. Yes, but I think I'll allow Nicodemus another 1 minute or so to wrap up this very, very rich and exciting conversation. Nicodemus, back to you. Thank you.
Thank you, Prof. So as I conclude, I think Adola has talked about the policy dilemma. Now, the country, previously, we have promoted the techno cities and smart cities, but yet now we have a policy direction towards adopting labor-intensive kind of work in the urban areas. Now we have a program dubbed Kazi Mtaani, which is really encouraging intensive labor-based kind of work so that we can cushion the vulnerable groups in the informal settlements. So this is something that we need to think through. Is that the direction that we want to go? Or should we have a blended kind of approach where we have the labor-based plus now adopting the technology? So that we can cushion our poor. So that's a discussion that I'll put back to the panel and see some of the recommendations or good practices that are happening elsewhere within the African continent. Thank you, moderator.
Thank you so much. Very, very succinct, very powerful presentation there. I must say that I just want to add that there are frameworks that are being developed by Council of Governors, and that it reminds me, Nicodemus, of the framework around spatial planning that I was involved in a little bit, and looking at various types of risks and resilience, which now we've actually replicated in Malawi and in Uganda, and actually also doing that in a number of Asian countries. And for our African participants, those who are operating outside of Nairobi, please, you're welcome. And like we said, do actually send your comments. I'll just read a couple of comments as Dr. Dorcas Nthoki prepares to take the floor. These are some of the issues that is coming in from the chat, just so that members are aware of the sort of discussions, the questions that are being raised. Patrick, I mean, there's a lot of appreciation, particularly on the issues you're bringing around policy, and that is really highly appreciated. Yes, of course, we hope to hear a little bit more of regional voices, the Afrocentricity in design. That is really something that has come out quite powerfully. Yes, Joel, and you're making reference here to the work that FAIRS and the Just City group in Kenya, including George Wesong and team, are actually working on. and what these have to do with exclusion. I think that's really, really very important. Patrick, of course, started us on the discourse of the policy dilemmas, and that was actually picked by Penina, and then has been picked further by Nicodemus, that actually we are in a situation where there are multiple competing policies, and Patrick took us all the way to the local level policy, and you compare that with national level policies and even international policy. They're pretty interesting, policy choices, and that we have to look at. So thank you so much, Joel, for highlighting that to us. We have the issue around public health and security. That is from Charles Kisame. And thanks, Charles, for highlighting that we are ill prepared to deal with the security infrastructure. There is the issue about the county vulnerability guide that Nicodemus was highlighting there. Thanks, George Wesonga, for highlighting that. Then the household as ecosystems. That's a critical issue. I'll come back to the comments as we continue with our discussions. But thank you so much. Without further ado, I hand over to Dorcas Nthoki. Dorcas, it'll be quite interesting to take you back to the issue of imaginaries and these contesting discourses and how you see them, from your perspective as a researcher. Who are the winners? Who are the losers? To you, Dorcas. Thank you.
Thank you. Yeah, first of all, just to mention very quickly, I'm not a doctor yet, but I'm working on it. I'm just heavily involved in research on urban development and urban mobility being at the core. So I resonate very much with what Penina has mentioned on the impact of COVID-19 on urban mobility and transport. But just to say very quickly, just a quote that I would like to mention that was made by David Harvey in 2008 that I feel is very relevant to our times today. So the freedom to make and remake our cities and ourselves is the most precious, yet the most neglected of our human rights. And this to support what Patrick has said is that issues of spatial planning, especially in southern cities, post-colonialism still remain are issues that we grapple with up to date, and how we plan our cities, understanding that each and every city has its own DNA and how different elements of the city function to produce a character of the city is varied across all different cities, and we cannot have an umbrella of resilience that we can say this is the outcome, this is the solution that we have to resilience. But we need to understand our cities fundamentally and understand the transitions that we're going through and how these can then be how we can modify them to fit into our own problems and how we can make our own cities resilient. And as much as COVID-19 seems to have presented some kind of doom, I see it as an opportunity that is inviting us as urban planners, as individuals, as urban dwellers, as government practitioners, and all around to rethink how we organize, how we plan our cities, both in a spatial dimension and in a social dimension, and in a human dimension. Who do we prioritize in the cities? And remembering that people make cities, so people must be at the forefront of planning for resilient cities, and not only the buildings or the systems that are put in place, but how do these systems then work to improve the livelihoods of the people living in the cities. And I would say that the conditions at present have to produce certain outcomes, and these outcomes will be as a result of how governance takes shape in our cities. And we have seen that, as Alia mentioned, that health systems, mobility systems, jobs have been vulnerable as a result of COVID-19, and public spaces have now become paramount areas of concern in our cities. I would say that all these have led to questioning how we transition in urban areas. And when Joel made his presentation on the difference between transition and transformation, I was waiting eagerly to see his perspective on transition, which I failed to see because he only concentrated on transformation. Just to critically look at that is, I would say transition is a process. Transformation is an outcome of transition. At least that's how I see it. And I see transition as a process, which leads to asking ourselves whether we see resilience as a process or as an end to itself. And I would say resilience is a process. As much as cities remain to be dynamic spaces, as much as issues of migration into cities continue to shape the norm of cities, and with all the prognosis of urban concentration in cities, with the future of cities being more than the capacity at present, then we expect that cities will continue to change and will continue to have more inhabitants. And as Kezia said, they are presented as spaces of risk. But I would say that cities are also spaces of opportunity. As much as you have more people concentrated in one space, you also have opportunities for people to innovate, for people to do things differently. And I would say the DNA of a city like Nairobi is innovation. And this has been seen from the different ways in how we have innovated how to make our lives easier, from mobile banking, to transport services, Uber, Boda Boda, and so on and so forth. So it's a question of identifying what exactly is our DNA and what can we use to build on that and to make our city resilient based on how it is at present. I would say a critical look at our very own city reveals that many features that urban planners and municipal administrators would principally be able to design and execute are generally absent or inadequate. And this has already been seen by how we have reacted to the health situation in the city. And Patrick went on and mentioned a long list of things that we have seen that have suddenly failed in the wake of COVID-19. And it's asking ourselves, then how do we think differently? How do we as individuals, as inhabitants of the cities, how do we change our social behavior to begin looking at things differently? But also, how do we change how we plan our cities? How do we respond to the different regulations that are there, the policies that exist? How do we enforce them in a way that we ensure that the situations that we're dealing with at present will also be in future produce some kind of resilience, such that if we are faced with the same problem in future, then we will be able to respond to it. And just to conclude, I get that as a conclusion.
I mean, I just want you to address one small matter. If you can take that in a minute or so as you conclude. Joel says that we need to think about Joel Onyango. He says that we need to think about the household ecosystem. What's happening at the household level, and how is that related or linked with what's happening at the urban level in terms of policies and so on? Maybe you can address that as you conclude. Thanks.
Yeah. Thank you for that question, because I think the move of housing policies now is densification. And what COVID-19 has presented is this complexity between densifying and retaining social distance. So as much as we are supposed to maintain social distancing, then at the same time we have to densify. So it's a kind of a conundrum that has hit most cities. But then the issues of density, I think, are issues that are not going to leave cities. And use of vertical space is something that we will continue to apply in cities. We are social beings, and we are the way people interact determine social proximities. And proximity is not only determined by space, but also social interaction. So we need to.
Thank you so much. Thank you but I know that there's still so much to discuss. But thank you so much, Dorcas, for those really exciting insights. And members, if you just allow me, let me just highlight a little bit of comments from my chat. Yes, Vincent Oje, thanks. Vincent was asking whether we actually have African examples that we can actually use in line with Vision 2063. Pascal Mukanga was highlighting that what are these opportunities that we can use towards resilience of cities based on our experience with COVID. We have issues around Tom Randa was talking about how do we cushion our cities from the perspective, from the issue of risks. Solim basically saying this is about adaptation and we need to figure out how to best adapt. El Komboka is saying fine, with the money being put into health infrastructure, how can we ensure that this also gets into the generic urban infrastructure? Penina is talking about telecommunication. Yeah, so please just keep putting in your comments, and shortly, in fact, I'll hand this back over so that we actually have more interactive conversation happening. But without further ado, may I take this chance to welcome Dr. Emmanuel Mideme, Center for Spatial Planning. Yes, and Dr. Ari, as we continue discussing these particular matters, these narratives that we are talking about, are they just things in our heads, or the situation in the ground is demanding for alternative narratives? And the question again is that can we be able to just do many things and sort out the problem without necessarily framing or reframing the problem, asking the question? Dr. Ari, I hope you're ready. Please get the platform. Dr. Emmanuel Mideme. Asante sana. And meanwhile, members, feel free to throw in your comments. We'll be going through them, and if there's specific questions, we'll ensure the answer. Thank you.
Thank you, Professor Omenya, for wonderful moderation. A lot has been spoken by those who had the floor before me. So basically, what I'll be doing is sometimes trying to reiterate what they've mentioned already, and probably to take on the question that Prof has just mentioned. Let me begin by reiterating what one speaker mentioned at the beginning, that resilience essentially is about adaptation. How can we build cities of the future that are able to weather the storms, cities that are able to adapt to the stresses and the shocks that are occasioned by whether these are natural disasters that are coming about as a result of climate change, whether we're talking about flooding, whether we're talking about landslides, whether we're talking about sea level rise. We've been experiencing a lot of lake level rise in the recent past, around Lake Victoria, and of course, the lakes within the Rift Valley. Now, in terms of policies and research that have gone in to try and deal with this, there's been a lot of work in terms of coming up with designs that address the geometric designs of cities. How can we design cities that can withstand flooding, landslides, sea level rise, and so on and so forth? And there's also been a bit of research trying to deal with the political dimension of things. How can we come up with political pronouncements or political processes that, for example, limit or reduce air pollution, for example, that was mentioned earlier on. One area that has not received so much attention, but I'm glad a lot of work is now being done on it, especially the work of Prof. Omenya and others, is with regard to economic resilience of our cities and towns. I know Prof. Omenya is doing a lot of work on local economic development with a number of towns across Kenya, but how can we be able to design, manage, and plan cities that are able to weather economic downturns? Now, in the international literature, there's been a lot of talk about Detroit in the United States and how it's trying to deal with the downturn in the automotive industry that has affected the fortunes of that particular country. But we also have examples closer home. I mean, we do know, for example, what happened to Webuye town following the decline in fortunes of Pan-African peppermints. what has happened to Mumia's sugar following, to Mumia's town following the decline or the near collapse of Mumia's sugar, for example. So these are some of the challenges when we're talking about resilience, adaptation of cities. How can we look at these multiple dimensions of resilience and adaptation so that we're able to really build cities that are truly, sustainable going forward? Now, given the fact that the speakers that came before me have mentioned a number of things, I would probably just want to summarize my contribution in terms of 3 key talking points. And the first thing I want to talk about is that I do think, and I do hope you'll agree with me, that we need not return to the normal, if at all there was such a thing before COVID happened. Professor did ask me to think about some of these imaginaries, discourses, and narratives. Are they just abstract talking points? Are they things that we can actually make good use of? I do know, for example, that before COVID happened, there was a lot of discourse. There was a narrative on the so-called post-normal city. How can cities be able, to function beyond the normal times? And I think COVID-19 has given us a perfect opportunity to begin to imagine and design and manage and build cities really that go beyond the normal operations as we were used to. I think the opportunity has presented us with a number of challenges, but the pandemic has presented us with a number of challenges, but also opportunities that we can actually ride on for us to be able to build better, more resilient, and of course, sustainable cities going forward. And of course, you can look at this in different dimensions. How, for example, can we design, spaces within our urban setups that are multi-purpose in nature so that they're not rendered obsolete during times of pandemics and other, urban shocks? I'm thinking, for example, of, market spaces. We did experiment with some market spaces in Kisumu, for example, to make them, be able to accommodate requirements such as social distancing and so on and so forth that were occasioned by the pandemic as it happened. So how can we be able to design cities of the future that are adaptable, that are able to adapt to, pandemics and other shocks and stresses that are likely to become more and more as we, continue to inhabit the urban world? How, again, for example, can we be able to design, in terms of housing, for example, and I know Prof. Omenya has done a lot of work on this, how can we be able to design homes going forward, for example, that is capable to facilitate, home-based care and, isolation, as we've seen in the recent past when we talked about, closing down some of the facilities, sending back the patients back home to be able to be taken care of under home-based care. Is it possible that in our future designs, in terms of policy and urban practice, to be able to create spaces that allow for that kind of eventuality going forward? Again, still talking about homes, is it possible to think going forward of how to design our homes to facilitate or to accommodate remote, to accommodate us working remotely, as as we are currently doing by holding this forum virtually? Now, in the wake of joblessness, again, a number of opportunities have been presented by COVID-19. How do we make use, how do we leverage on IT and of course other emerging technologies to be able to create jobs, especially for the youth? I do know, for example, there are a number of youth and university students that I work with a lot. A number of them have taken to coding, for example, learning coding from home, in the hope that going forward there will be a number of jobs, a number of work that revolve around IT that will be essentially be performed online. And of course, in terms of these questions that I'm asking myself, I was just thinking of how can we be able, as urban practitioners, as urban actors, to revalorize the contribution of the so-called taken for granted cadres, the mama bolders, the watchmen, the border riders, and so on and so forth. You will agree with me that beyond the frontline medical staff, these are the fellows who actually stood in the gap while the majority of us sat back at home, afraid and knowing, unaware of what to, sure of what to happen the next day. But these fellows have been able to sort of, keep things running. So how do we again go back and begin to valorize the contribution, the useful contribution made by these, cadres of urban workers, so that we can be able to support them through effective policies that then can be able to, to mainstream their contributions in the overall framework of urban economies going forward. Another key talking point that I probably want to...
Yes, Emmanuel, thank you so much. I think yeah, you can wind up so that we can hand over back the program to the team. But thanks for particularly bringing in quite strongly that idea of the economic development and also the idea of the marginalized. Yeah, but yeah, please feel free to wind up in the next 1 minute or so that we can hand over back. Yeah, because of time.
Thank you, Prof. Just to wind up, another issue that I probably want to point out is the question of diversity and pluralism. When we're talking about urban resilience and adaptation, many of the policies that we've had in the past have tended to be monolithic in nature. You know, the one-size-fits-all approach, whether we're talking about housing policy, whether we're talking about land tenure policy, and so on and so forth. How can we begin to think beyond monolithic entities, whether this is about housing provision, whether we're talking about public transport, whether we're talking about solid waste management, water service provision, and many others? How can we begin to identify and valorize other alternative means and modes of producing services so that these two can be brought into the mainstream and supported through appropriate policies that therefore can be able to, you know, meet the demands of various needs of the urban residents or urban dwellers that we have in our cities today? In the interest of time, I think I'll end there and take the program back to the moderator. Thank you.
Yep. Thank you so much. Thank you so much, Dr. I think, and thank you all the panelists, Patrick, Penina, Nicodemus, Dorcas, Emmanuel. As you members, as you can see, these are rich area. There's a lot of practical knowledge that we have. There's a lot of scientific and framing work that's going on. And of course, from the insights that we're getting from the chat, a lot of you actually do have an interest in this, and we're actually very, very excited that we've been accorded this particular opportunity to be able to contribute to this research on resilience of African cities post-COVID. And I believe that through your contributions, we should be able to get some very, very interesting and robust insights in terms of how we actually shape our cities. And for Kezia and team, and thank you so much, Kezia and Joel and my friend Winnie, Charles, for setting up that particular conversation, and then of course for the continued discourse that you're generating. And I believe that through this particular process, something useful, not just for the purposes of publications and books, but something useful for actual transformation of work on the ground that we are doing, will actually come out. And as you can see, there's so many of us here who are yearning for this knowledge, for frameworks, for practical advisories in terms of how to move forward. But at this juncture, ladies and gentlemen, allow me to hand back over the program to Kezia to take us through some discussions in terms of concluding thoughts, and maybe even a couple of other opportunities for participants to say one or two things. Thank you so much, Kezia, and thank you everyone for this wonderful, I feel at home, for this really beautiful conversation that's happening. Thank you. Back to you, Kezia.
All right. Thank you so much, Professor Omenya, for leading the discussion, and for our panelists. Thank you so much for sharing your insightful ideas about what you're doing in your different spheres. And I'm also excited about the discussions that we are having here. I think it's really important to see all of us excited about thinking about how can we rebuild our cities. And I think, as most of us have mentioned, that COVID-19, of course, is a challenge, but it's also provided opportunities for us to rethink how we build our cities. And from Alfred Omenya, when he began, he actually mentioned that most of the responses that we've had from our governments in different areas have not been, dealing with the right aspects and the right responses. There are a lot of gaps. And we've heard from our presenters of what is happening and what are some of the ways that we can now start to rethink about these issues, and how we can inform the policies that different governments are taking or are putting into place to rebuild the economies, to rebuild the social aspects, and so forth. And so I'm going to just recap a few of the things that we've had from our presenters. And one of the things Patrick said is that we need to think about cities that respond to the needs of Africans. So you mentioned that some of the cities we've inherited, we still have some, colonial perspectives on how cities should look like and how cities should be built. But then we need now to start thinking as Africans, what kind of cities work for us, and what is it that we would like to see, and what is it that counts as a resilient city for us? Because as Doc has mentioned, that we need to look at each city and figure out what is the DNA of that city, and what are some of the things that we can actually do to ensure that particular city is resilient, because all cities cannot have a one-size-fits-all solution when it comes to this rebuilding process. Penina talked about the opportunities that have come with COVID-19 when it comes to how we build the different aspects of the city, whether we're talking about transportation, housing, and how we can link this up. And also we've seen cities reclaiming some of the spaces that were encouraging some behaviors that cannot lead to resilience, like the over-reliance of private vehicles in most of our African cities. So reclaiming that for cycling, for walking, and so forth is one way that cities are beginning to enhance resilience. And also Nicodemus shared the fact that now counties are beginning to rethink of some of the ways they can enhance economic vitality in their regions and so forth, and the existing policies, whether they actually provide what they claim to provide, and how they can help, and how we can have now policies that actually respond to the needs of our African context. And I think there's something that Joel mentioned in the charts, that maybe COVID-19 is a critical juncture that we can take advantage of and use that to actually change our policies and our practice towards building a resilient city. And Dr. Mideme has talked about economic resilience. So during the response to COVID-19, we've seen a lot of focus on the health sector. But when you look at the impact, there's a lot of adverse effects on the economic aspect. So one way is to think about how we build resilience of cities. And I think it was Nicodemus who talked about cities previously claiming they don't have enough resources, but now they've been able to establish other avenues where they can generate income. So thank you so much for contributing to that. I think in the interest of time, we've had your comments on the charts that I think Professor Omenya did a great job in just going back to them and reading them. And I think we're going to save these charts and be able to, go back and see what are some of the issues that have not been addressed. But at this moment, I think we have our regional focal points. So ARIN is basically an African outfit, and we have representatives from the different regions. We have a focal point from the Southern Africa region and West Africa region. So if they have any addition, they can just take 1 minute to contribute their perspectives, although I saw some of them were also contributing in the chats. But I think it would be great just to hear them speak about what is happening in the West African region, South African region. And I'm going to give this chance to our focal points. I think I saw Faye and Matthew here. So if they're around, they can just take 1 minute and give their perspectives before we bring in Dr. Johannes Atela to close this seminar for us.